Tuberculosis (TB) is an respiratory disease. Look at this chest X-ray, normal, and TB lungs, CT findings. Look at this. Then MRI findings. Detail going on. Introduction. Tuberculosis is a contagious infection that primarily affects the lungs but can impact other organs through hematogenous spread. Despite being preventable and treatable, TB remains one of the top 10 causes of death worldwide. It spreads through airborne droplets. When a person with active TB cough, sneezing, or talks, definition. Tuberculosis is defined as a chronic infectious disease caused by Mycobacterium tuberculosis. It is primarily a pulmonary disease but can be systemic, involving multiple organs. Types. 1. Pulmonary tuberculosis, the most common form affecting the lungs. Extrapulmonary tuberculosis occurs when TB affects organs other than the lungs, such as lymph nodes, pleura, bones, and joints. Genitourinary tract and the central nervous system. Three, latent tuberculosis infection. The bacteria are present in the body but remain inactive and cause no symptoms. LTBI can active into TB disease, particularly if the immune system become weakened. 4. Active tuberculosis. The bacteria are active and multiplying, causing symptoms and spreading to others. Causes. TB is caused by Mycobacterium tuberculosis. The bacterium is transmitted from person to person through airborne particles expelled when a infected person with active TB cough, sneezes, speaks, or sings. Risk factors. 1. HIV/AIDS, compromised immune system, or more susceptible to TB. 2. Diabetes, increase the risk of TB progression. 3. Immunosuppressive treatment. Example, corticosteroids, chemotherapy. 4. Close contact with TB patients, especially in crowded living conditions. 5. Malnutrition. weakens the immune system. 6. Substance abuse, alcohol, drugs can increase the risk. 7. Living or traveling to high TB prevalence areas increase the exposure. 8. Occupational exposure, healthcare workers are at high risk. Complications. 1. Miliary TB, a severe from where TB spread to multiple organs. 2. Pleural effusion and emphysema, fluid accumulation around the lungs. 3. TB meningitis affects the brain and spinal cord. 4. Spinal TB, Pott's disease, leads to spinal pain and possible deformities. 5. Heart disorders, TB pericarditis can cause chronic inflammation of the heart's membrane. 6. Respiratory failures due to extensive lung damage. Pathophysiology. Once inhaled Microbacterium tuberculosis reaches the alveoli of the lungs, where it is engulfed by macrophages. The bacteria multiply within the macrophages, leading to the formation of a granuloma, a hallmark of TB. The granuloma can remain stable, leading to latent TB, or it can break down, releasing bacteria into the lungs and bloodstream, causing active TB. In latent TB, the immune system controls the infection but cannot eliminate it. Active TB occurs when the immune system fails to contain the bacteria, leading to the breakdown of granulomas and the spread of TB. Here, step-by-step breakdown of pathophysiology. 1. Inhalation and entry. Exposure, Microbacterium tuberculosis. 2. Alveolar deposition, lung entry. 3. Bacterial replication, survival in macrophages, Mycobacterium tuberculosis. 4. Formation of granulomas, immune system response, latent TB. A 5. Potential breakdown of granulomas, immunosuppression. If the immune system weakens due to HIV, malnutrition and aging, etc. 6. Progression to active TB, active disease. The breakdown of granulomas leads to active TB disease. Transmission during active TB can be transmitted to others. 7. Systemic spread. Extrapulmonary TB in some cases. Mycobacterium tuberculosis spreads beyond the lungs to other organs such as the lymph nodes, bones, kidney or brain, leading to extrapulmonary TB. Miliary TB, if the bacteria enter the bloodstream and spread throughout the body, it can result in miliary TB. 8. Chronic inflammation and tissue damage. Signs and symptoms. 1. Persistent cough lasts for more than 3 weeks. 2. Hemoptysis, coughing up blood. 3. Chest pain, pain during breathing or coughing. 4. Fever, often low grade and may be accompanied by night sweats. 5. Chills, commonly associated with the fever. 6. Weight loss, unintentional and progressive. 7. Fatigue, persistent tiredness and weakness. 8. Loss of appetite, decreased desire to eat. Diagnosis. 1. Mantoux tuberculin skin test (TST) detects previous exposure to TB bacteria. 2. Interferono gamma release assays (IGRAS), blood test that measure the immune response to TB bacteria. 3. Chest X-ray identifies abnormalities in the lungs. 4. Sputum smear microscopy detect acid fast bacilli AFB in sputum. 5. Sputum culture, the gold standard for confirming TB, although results take a week. 6. Nucleic acid amplification test NAAT, rapid test that detect TB DNA. 7. Biopsy in case of extrapulmonary TB. Nursing diagnosis. 1. Ineffective airway clearance related to secretions in the airways. 2. Imbalanced nutrition, less than body requirements due to decreased appetite. 3. Activity intolerance related to fatigue and weakness. 4. Risk for infection related to spread of TB bacteria. 5. Impaired gas exchanges related to alveolar capillary membrane changes. Management. 1. Airborne precautions, use of negative pressure rooms and N95 mask. 2. Medication adherence, educating patients on the importance of completing the full course of treatment. 3. Nutritional support, ensuring adequate caloric intake. 4. Monitoring respiratory status, regular assessment of lung function and symptoms. 5. Patient education, teaching about the disease, treatment regimes, and preventing transmission. 6. Supportive care, providing emotional support and helping patients cope with social stigma. Treatment: 1. First line anti-TB drugs. 2. Isonalized INH inhibit cell wall synthesis. 3. Rifampicin RIF inhibits RNA synthesis. 4. Ethambutol EMB inhibit cell wall synthesis. 5. Pyrazinamide PZA disturbs the cell membranes. 6. Second line drugs used for drug resistant TB. Example: fluoroquinolones, aminoglycosides. 7. DOTS directly absorbed treatment. Short course: a World Health Organization recommended strategy to ensure treatment adherence. Psychosocial medicine: 1. Counseling, addressing the psychological impact of TB, such as fever, anxiety, and social isolation. 2. Support groups, connecting patients with others who have TB for shared experiences and mutual support. 4. Addressing stigma, educating the community to reduce stigma and discrimination against TB patients. 4. Mental health services, providing access to mental health professionals for those struggling with emotional burden of the disease. Prevention: 1. PCG vaccination administered to infants in countries with high TB prevalence. 2. Infection control measures, use of mask, proper ventilation, and isolating infectious patients. 3. Regular screening for high risk groups like healthcare workers and those with HIV. 4. Public health education, raising awareness about TB transmission, symptoms, and the importance of early treatment. 5. Contact tracing, identifying and testing individuals who have been in close contact with TB patients. In conclusion, tuberculosis remains a serious public health issue, but with appropriate management and preventive measures, it is possible to control and eventually eradicate the disease. Comprehensive care that includes medical treatment, nursing management, and psychosocial support is essential to effectively treat TB and prevent its spread. Education and the awareness are key components in the fight against TB, ensuring that individuals understand the importance of prevention, early detection, and adherence to treatment. Thank you. Have a good day.